Good morning, everyone. We'll be starting in a minute. Enjoy your coffee. Finish in 30 seconds. So we are ready to start. Good morning, everyone. My name is Rosen Plevneliev. I was very proud to serve as President of Bulgaria for the period 2012-2017. Very proud member of the board of AJC, and we want to welcome you today. It's our second day, but every panel, every speaker is important for us. NJC is very proud of understanding, tolerance, dialogue. That's what we believe in. That's what we are doing. We're bringing everybody together, from political makers, business leaders, young leaders, all the regions, different institutions, and that's what we have also today on the panel. It's extremely important topic. That is why we are starting with introductory video from our hosts. So let's have the video from NJC.
Devastating epidemic can start in any country at any time and kill millions of people because we're not prepared.
As we emerge from confronting the worst pandemic in a century, we all recognize the importance of ensuring health for all. The pandemic exposed how far we are from the needed responses. Lessons learned?
WHO has outlined 5 priorities for a healthier, safer, fairer, and more sustainable world. We call them the 5 Ps: promoting, providing, protecting, powering, and performing for health.
We have to ensure that actions are taken now to be better prepared to cope with future challenges. Welcome to the panel, Building a Renewed Global Health Architecture, Promoting, Providing, Protecting.
Thank you very much for that video. It's really coming to the most important to all of us topic, life. And of course, the way we pass through very difficult moments. There is a small wisdom. I really believe in that. Even my grandfather and many others are telling me, when it's easy in your lifetime, it's not important. You just pass through. When it's difficult, it's really important. And that applies also for humans, for families, for countries, societies, but also for the humanity. It was difficult. There was a pandemic, there was a virus, a deadly virus. How did we pass through that very important, difficult moment? What have we learned? How can we get better when the next time comes? And of course, the most important question to all of us, together, institutions, industries, governments, only together. And here is, of course, my panel. I will be very happy to moderate, and we promise we'll be on time. We will be trying to collect most of the questions and answer them. And again, what can we do to be better for the next time? Here is my first speaker, a very distinguished friend of ours, of NJC. We organized a lot of discussions together, and we are very proud to have him again with us. That's, of course, the Director General of WHO, Mr. Ghebreyesus. Here is a video address from him.
Your Excellency, former President Plevneliev, Your Excellency, former Prime Minister Brown, dear colleagues and friends. As we recover and rebuild from the COVID-19 pandemic, we must kickstart progress towards the health-related targets in the Sustainable Development Goals and WHO's triple billion targets. Even before the pandemic, we were well off track for the SDGs. Now, we're even further behind. But the pandemic has only shown us why the SDGs are so important and why we must pursue them with even more innovation, collaboration and determination. WHO is proposing 5 priorities on which we're urging all countries to focus. We call them the 5 Ps: promoting, providing, protecting, powering, and performing for health. Let me explain each one briefly. The first priority is promoting health and preventing disease by addressing its root causes. We must recognize that health does not begin in hospitals or clinics, but in homes, streets, schools, workplaces, markets, and communities. Much of the work that ministries of health do is dealing with the consequences of unhealthy diets, unsafe water and sanitation, polluted environments, dangerous roads and workplaces, and the aggressive marketing of products that harm health. WHO is therefore calling on all countries to make a paradigm shift to address the drivers of disease with a whole of government, whole of society approach. The second priority is providing health by radically reorienting health systems towards primary health care as the foundation of universal health coverage. More than 90% of essential health services can be delivered through primary health care, including routine vaccination, prevention and treatment for communicable and non-communicable diseases, and services for sexual and reproductive health. Strong primary health care can avoid or delay the need for more costly secondary and tertiary care. This kind of primary health care depends on a health workforce with decent pay and decent working conditions. At the eyes and ears of the health system, primary health care also plays a vital role in detecting outbreaks at their earliest stage, which leads me to the third priority: protecting health by strengthening preparedness, response, and resilience at the local, national, regional, and global level. There have been multiple reviews of the global response to COVID-19, with more than 300 recommendations. Based on an analysis of those recommendations, WHO has proposed a cohesive framework for a stronger architecture for health emergency preparedness and response, with stronger governance, stronger financing, stronger systems and tools, and a stronger WHO at its center. Some of that architecture is already being built, including the International Accord on Pandemic Prevention, Preparedness and Response, the Pandemic Fund, the Hub for Pandemic and Epidemic Intelligence in Berlin, and the mRNA Vaccine Technology Transfer Hub in South Africa. The fourth and fifth priorities are enablers of the first three. The fourth is powering health by harnessing science, research, innovation, data, digital technologies, and partnership. And the fifth is performing for health by building a stronger, more agile WHO that's better placed to support countries to achieve their national priorities. Excellencies, dear colleagues and friends, this year marks the 75th anniversary of the founding of the World Health Organization. In 1948, nations came together to recognize that health is not a luxury for the rich, but a human right for all, an end in itself. More than ever before, the world needs strong visionary leadership and global cooperation rooted in solidarity to realize that right. I thank you.
That was a special address from the Director General. We are very, very, very grateful for his activity, cooperation with all of us. his passion, and we're looking together for solutions. Now I'm moving to my speakers, and the first will be Madam Winnie Bianima. She is Executive Director of UNAIDS and Under-Secretary General of the United Nations. The floor is yours. Thank you, madam.
Thank you, moderator. It's a great honor to be on this very distinguished panel that you're moderating. Tomorrow, it will be 3 years since WHO declared COVID-19 a pandemic. Just like in an earlier pandemic that's still ongoing, the HIV pandemic, pharmaceutical companies focused on the rich countries and on maximizing profits for themselves. Pfizer made 37.8, almost $38 billion from its COVID vaccine alone in 1 year, 2022. Had governments shared vaccines equitably with the world, 1.3 million lives could have been saved in the first year of the COVID vaccine, of the COVID pandemic, 2021. That is one preventable death every 24 seconds. We could have saved those lives. But today, 26% of people in the global south, most of the developing countries, have received just 1 dose of COVID vaccine, while people in the richer countries, 72% have got that. Life-saving technologies, such as vaccines, must be treated as global public goods. They cannot be sold the way you sell your nice smartphone. Technology transfer to the global south has to happen. My brother Tedros has just talked about the mRNA hub in South Africa, started by WHO and the government of South Africa. South Africa was able to manufacture the Moderna vaccine, something close to Moderna, just in the first year. But the capacity to pull it to commercial production level wasn't there. It's slowly being built. These efforts must be supported if we are not going to sleepwalk ourselves into our next pandemic. So, world leaders have to fix the structural problems that are causing these kinds of inequalities that are resulting in deaths, millions of deaths of people. It is the duty of governments and leaders to fix those structural problems in the trade rules, in the intellectual property rules, in the tax rules, and so on. Today, at the United Nations this year, we are having very important negotiations intended to prepare us to be better prepared for a next pandemic, to prevent it from happening. These negotiations are key. First, the international health regulations are being amended. There's a negotiation to fix those gaps that my brother Tedros talked about, that don't enable the sharing of information, the sharing of science, in order for everyone's life to be saved. These negotiations are critical. The engagement of all governments is critical, but the East-West tensions are politicizing these discussions. This is where our voices and our leadership is important. Secondly, the pandemic's preparedness, prevention, and response treaty is also being negotiated, may conclude by next year in June at the World Health Assembly. Again, a very important negotiation. Here, the issues of access to medicines, access to health technologies are key. But we are already seeing efforts to put these aside and have them as a separate negotiation that could go on for 20 years to the benefit of companies, of course, as they make profits and as people die. So there will be high-level meetings at the United Nations in September. Governments will meet. One will be on a statement on the Pandemic Preparedness and Response Treaty to generate momentum to reach conclusion, and another one on universal health coverage. These high-level meetings are critical. I invite all of you, leaders, current leaders, leaders who have moved on and are leaders in your communities and countries and on the global stage, to engage and push our governments to be ambitious about saving lives. I thank you.
Thank you, Madam. Very strong words. We learned a lot, and here is our appeal. We have 65 countries represented here at the Global Baku Forum, and let us put pressure on all of our governments, because let's call it the 5P treaty you're talking about, which is coming to the agenda this September at the UN and next year to be signed as a global consensus. We need to do that. Let's work together on that. So you might now wonder, why do I have my next speaker on the panel? Madam Mokhtar, she is the Deputy Director General of the International Atomic Energy Agency. Well, listen to her presentation. You will understand why.
Thank you, Mr. Chair, and good morning, everyone. Yes, maybe most of you are wondering why the International Atomic Energy is here. We should be dealing with in Ukraine or Iran or North Korea. But guess what? We are a technical agency. We are offering the technology to each and everyone in a wide range of areas. Name it: human health, food and agriculture, environmental monitoring, water monitoring. It's all about technology. We just talked about science and research. And also the DG of WHO mentioned the importance of science and technology. As we have heard several times, and just this morning, that the COVID-19 epidemic set us for decades back, and we are behind reaching out to the SDGs. So not only about preparedness for pandemic, but also for other diseases. And I will give an example, non-communicable diseases. I will focus on cancer, because this is one of the topics that International Atomic Energy is focusing on, offering radiation medicine, imaging, treatment, radiotherapy for cancer. And we have done a study, a Lancet study, recently, I think 2 years ago, where we have shown that 30 countries in Africa, they don't have access on medical imaging and radiotherapy. 50% of cancer patients, they need radiotherapy, otherwise they will die. 50%. 30 countries, they don't have access. And globally, 30% of people, they don't have access to radiation medicine, while only 2% of development aid is given to non-communicable diseases. Only 2%. So how you want to reach the goal if the funding organization, they are not giving fund to strengthen the infrastructure for non-communicable diseases? And what we are doing at the agency, our Director General said, we can't keep silent. We have to do something. And he launched an initiative called Rays of Hope. The aim is to team up with countries to give access to each and everyone, access to medical imaging, early diagnosis, access to treatment. And we are teaming up with WHO. We are teaming up with each and everyone that want to join this initiative. We started with Africa. DG launched it in African Union last year. And we started with 6 first countries. As we speak, we are building infrastructure in Malawi. We are giving procurement to Senegal of CT scan. We are giving radiotherapy linear accelerator to Kenya, and much more. But we are not funding agency. We need support. But more importantly, is the commitment of countries. Countries have to commit and take also their responsibilities. It's not only about infrastructure. It's about safety, it's about people, it's about training, it's about nurses, radiation oncologists, medical imaging specialists, nuclear medicine specialists, academia strengthening. All of this need a holistic approach, and all of this needs also multi-stakeholders, private sector, like my colleague here talked about, engagement. One linear accelerator costs 5 million euros. A country like Malawi needs 70 linear accelerators to give access to everyone. This is a lot of money. So we need really engagement with everybody. So we are far behind giving access and far behind tackling non-communicable disease. Now, going back to the pandemic preparedness that DG, WHO, and also my colleague here talked about. We had monkeypox in Europe just recently. A month ago, a girl died in Cambodia because of avian influenza. So we are not far from another pandemic. What are we doing? We are doing a treaty, preparing a treaty. We are giving a fund, but on the ground, what are we doing? That's the question that we need to ask ourselves, what each one of us is doing. So this is the question that each one of us should ask. At the IAEA, we have a program jointly with FAO, and we are working with the member states to strengthen the veterinary laboratories. Remember, COVID-19, thank you. COVID-19 came from animal, came from the field, came from the environment. And we need really to strengthen animal health science and animal health infrastructure. And again, this area is neglected. There is no funding coming there. What we are doing is we are building the biggest ever network of veterinary laboratories to be equipped, to be trained, to go out in the field and look at what are the pathogens out there and surveil them, monitor them, so that to avoid any spillover to humans of pathogens. Which means we are not finding the magic solution to stop a pandemic, but we are doing our part. Now, if we talk about science, innovation, and data, this is also, my colleagues talked about. Research is not funded, and technology is not funded in developing countries. And we need to enhance that. We need to enhance science and technology. We need to find easy tools to low and middle income countries to be used to go and look for disease and to detect them early enough to avoid any spillover. And this is, again, we have a huge program of research and development we call coordinated research program, where we bring South and North together, developing and developed countries to do research. In developing, I'm from Africa. Research is not enhanced. Research is not supported. And we need to do that. And without research, without data, we cannot reach the goals. And this is what we need, this is what we are doing at IEA. We are enhancing research. We are enhancing capacity in research. How to do it, how to put protocol, how to go out and sample, how to analyze, how to provide data, how to publish. So all this needed in developing countries, and all this is the responsibility of each one of us. I'll stop here, Mr. Chair.
Thank you. You sent a very clear and a very strong message. The only way to succeed is through institutions. There is no other way. And you represent a very important institution that is there to help. So my next speaker, he served 16 years head of state. Well, that's a lot, and a lot of wisdom collected. That's the president of a wonderful country, Montenegro, very beautiful, in the heart of Europe and the Balkans. And Filip Vujanovic is also a member of the board of AGSC, so he's representing also this great organization. Mr. President, the floor is yours.
Dear Ross and dear friends, thank you for describing my country as a beautiful country, and we are so proud concerning it. But in terms of pandemic, coronavirus, Montenegro has had two regimes. First, isolation of citizens in their homes and totally closed borders. And we became corona-free state during months. But it is not be isolated country, and when we opened our borders, we have had increasing level on affected person and very high level of unfortunately died person. Prime Minister Zlatko Lagumdžija announced in similar panel in Geneva very tragic fact that among 7 countries in the world, 5 are at the topic position concerning dead people. It is so strange, per million certainly, and nobody is explained what should be the reason. Maybe low level of discipline of citizens concerning measures of pandemic coronavirus, maybe low level of health care, maybe something else. But it is very strange. And I expect experts to describe it to public and to know what could be reason for such consequences. Until now, according to official data, more than 6.8 million people died from pandemic, and according to unofficial calculation, even 10 million people. It is truly tragic balance, and the price of pandemic is too high, and it is increasing every day, unfortunately. The past 3 years have shown the greatest success of the pharmaceutical industry and medicine, but also failures and abuses that must not be repeated. It is a matter of great respect and admiration that in short time since the appearance of coronavirus, a vaccine was found, and that the pharmaceutical industry ensured a high production level. Unfortunately, in order to make a profit, there were pharmaceutical companies that sold most of the vaccines to rich countries, creating vaccine surpluses and that were destroyed. In the first year of pandemic alone, according to available data, inadequate and unfair distribution of vaccine to low development and developing countries resulted in loss of 1.3 million lives. The coronavirus pandemic will also be remembered for the fact that millions of people lost their lives due to the profit of pharmaceutical companies. Could these companies have been forced to act differently? Who could have forced them to do that, and how? Nobody. I think nobody. It is certain that for them, profit was more important than human lives. We live in time and humanity in which profit was more important than human lives. This is the sad truth of modern humanity. As a side effect of pandemic, Southeast Europe faced a deep economic crisis. High inflation and the lack of energy have significantly worsened the economic situation. According to the surveys done after the peak of coronavirus, even 20.5% of population in the region lives below of the poverty level, and 16% of population is unemployed, of which around 34% are young people. Very tragical facts. As an important part of Southeast Europe, the Western Balkans had numerous and significant problems in the fight against the pandemic. The Western Balkan countries did not have an adequate level of regional cooperation. They were limited only to exchanging information experiences through the health north of southeastern Europe. Regional planning and coordination of activities were missing. Better cooperation with the European Union was also necessary. It is certain that problem in the pandemic additionally influenced the increasing in the negative trend of young people wanting to leave our countries. The latest research shows that even 76% of young people want to live and work outside of the Western Balkans. This must be certainly concerned all the countries of the Western Balkans and oblige them to improve the level of healthcare and cooperation in it. The pandemic has demonstrated the irreplaceable value of multilateralism and tragic consequences of unilateral and uncoordinated action. The pandemic, as well as global danger and challenges, require a global response. That is why the role of the United Nations and its special agency is extremely important. During the pandemic, the World Health Organization has shown its importance and values. The tragic outcome of pandemic and inadequate response and serious warnings and alerts. In order to provide a better health system, we must rise not only above particular economic and political interests, but also above our differences. In conclusion, the pandemic shows us that healthcare is not a matter of choice, but an obligation towards future generations and even the survival of humanity itself. Thank you for your attention.
Thank you, Mr. President. As a very experienced politician, of course, you were pointing the problems, because the only way to solve a problem, if you don't hide it, you point at the problem. But also you said something extremely important about the discipline, about the responsibility of each and every person on this planet. Don't follow conspiracy theories when it's about human health. Just really take your own responsibility for your families, for your children, for your countries, and be reasonable. So we are moving further, and especially I want to show to our next guest, this is the Minister of Health of the Republic of Azerbaijan. Mr. Minister, I use the opportunity to thank you. You represent the government of Azerbaijan for your support for the Global Baku Forum, for AGAC, so that we could come together, and we will listen very carefully to your presentation. The floor is yours. Thank you.
Your Excellencies, distinguished guests, ladies and gentlemen. My speech may sound like a statement, but being a healthcare professional, I have no choice but do like that. After COVID-19 pandemic, building a renewed global health architecture has become a matter of utmost urgency. I am confident that today's panel discussions on shaping the future of global health will contribute to strengthening our joint efforts against possible health threats to humanity. The emergency situations occurred during the past few years have revealed the fragility of human civilization against unforeseen circumstances such as outbreak of life-threatening diseases, natural disasters, military conflicts. Better emergency preparedness and timely elimination of its consequences require a resilient global health infrastructure. In order to mitigate the risk on global health and to achieve shock-resistant healthcare systems, adequate measures should be implemented both internationally and at national levels. Health promotion is central to achieve health-related sustainable development goals at the national level and build stronger healthcare systems. Life expectancy is rising globally, so health experts should prioritize health for all throughout the life course. Instead of fighting against certain diseases, we should focus on the roots of illnesses by means of promoting healthy lifestyle among all age groups of society. One of the targets of the 2022-2026 socio-economic development strategy of the Republic of Azerbaijan, approved by the decree of the President, His Excellency Mr. Ilham Aliyev, is to ensure a healthy lifestyle for all citizens. The healthy lifestyle of citizens begins in the mother's womb. Healthy nutrition of children in early childhood, promotion of healthy lifestyles in educational institutions, physical activity for all population groups, staying away from bad habits, promotion of well-being are the priority directions defined in the National Public Health Agenda. Given the fact that there is a relationship between individuals' lifestyle and healthcare costs, citizens should be encouraged to take active participation in healthy lifestyle programs and share health responsibility with governments. Individuals' behavior change can work to achieve improved health outcomes. COVID-19 pandemic has changed the understanding of global healthcare. It's not viewed just a public issue anymore. In a broader sense, it ranges from economics to security. As health is a fundamental human right, increase of financial resources should be directed towards achieving equity. Financing is one of the key building blocks of resilient healthcare system. Investments in health sector is investment in shared futures. Funding in information technologies in the renewed global healthcare will make medical services more accessible, decrease operating costs, at the same time boost economy. Better use of big health data is critical for decision-making in case of emergencies. So, enhancement of innovative digital healthcare platforms plays a crucial role in sharing health data and ensuring patients to receive timely and proper care. The role of private sector is as a critical partner in management of unexpected circumstances should not be underestimated. The involvement of private sector in renewed global healthcare should be promoted as providing efficiency in service delivery, enhancing access in information technologies, co-financing of innovative projects. Access to essential medicines is problematic for 1/3 of all persons worldwide. The price of medicine is unaffordable for the least developed countries. Transfer of new technologies, review of pricing models, overcoming intellectual property obstacles, application of product development partnerships could facilitate access of population to essential drugs. We encourage World Health Organization as a global coordinating health authority to keep setting norms and standards to protect public health and well-being of the world population. While building renewed global health architecture, engagement with non-state actors, civil society organizations could play the active role in promotion of public health activities, contribute to smooth application of emerging health initiatives, norms and standards. Since vaccination is a critical part of preventive health care, the backbone of public health, we call expansion of existing vaccines provision programs and the establishment of new partnerships regionally and internationally. Besides, it's time to develop a global viable emergency health policy to ensure resilience and sustainable standardized preparedness for future natural man-made emergencies. Health authorities should develop strategic plans to build capacities of medical students, frontline healthcare workers, and hospital staff to manage any emergency. Inclusion of evidence-based disaster-themed programs in medical education could be one of the strategic options. Implementing disaster training programs for healthcare workers will improve knowledge and skills that are important during the times of emergencies. Behavioral health disorders are mostly seen after exposure to disaster, and each disaster, unfortunately, produces unique impacts that require the tailoring of psychosocial responses. The role of mental health professionals should be extended in recovery and rehabilitation procedures of affected groups. Dear all, the pandemic unmasks the essential role of public health in ensuring uninterrupted functioning of other critical infrastructure. Public health emergencies typically result in a shortage of medical resources. We propose management of health resources during large-scale disasters be coordinated by WHO. establishment of unified emergency rescue resource allocation system under the auspices of World Health Organization could be an effective coordination mechanism. In addition, to facilitate the provision of support during emergencies, development of evidence-based international standards and guidelines on multidisciplinary health response is required. I would like traditionally to conclude my speech with the words of great sage Nizami Ganjavi. There are locked doors and no keys, but sooner or later openers will appear. Thank you.
Thank you, Mr. Minister. You shared with us the very ambitious plans of Azerbaijan, but also you pointed how important is international cooperation in international institutions to achieve not just results, but sustainable, good results. My next speaker, it's very easy for me to give him the floor. He's not just the Prime Minister of another wonderful country in the Balkans, Bosnia-Herzegovina, but we all call him just Zlatko. Zlatko is the heart of everything you can imagine, but he's a very exciting speaker too. I listened to his presentations at least 100 times. This will be 101st, but anytime he speaks, he has something to say. So listen to him. Thank you.
Well, thank you, Rosen. Better you didn't say that, because now I'm obliged to say something important and smart, which will be really tough after that introduction. Of course, I had some of my notes before, but I was listening to my predecessors, and the latest ones, of course, my dear friend Temur and Philip, who reminded me of a few things. Let me start with something which is known as European Health Union. Back in the midst of pandemic, European Union called for European Health Union, which is supposed to go beyond European Union, which is very important. Then a year ago, exactly a year ago, there was a Lyon Declaration adopted as a long-term commitment for future generations on healthcare under French European Union leadership. And Health Declaration, under the title The Global Responsibility, Think Health Globally and Act Locally, similar to what we are talking about today. And it's stating, among other things, that converging on health as a global integrative common should be shared denominator of EU's Green Deal and digital transformation. Temur was just talking about the importance of digital transformation about it, as Azerbaijan is, and he's personally leading that area, I know that, to building, as we can call it, the digital platform for health. And there are two issues that I want to just remind you as part of that European Health Union. And then, under French presidency, on May 9, on European Day, Day of Victory over Fascism, President Macron called for European political community. Just some months later, in October last year in Prague, there was a European political community meeting that gathered together 44 countries, which showed actually that European Union is just one part of what we call Europe. That Europe goes beyond the borders of 27 plus countries. And in Prague, there was significant presence and importance of President Aliyev because of energy transition and energy transition in the world, but especially in Europe, and considering this country as well. What this has to do with health? I think that there are two issues that were now related to European political community and European health community. First issue is triangle in between health, green, and digital, as it is stated over there. The second one, if European Union wants to go global, because in European Health Union and that Lyon Declaration, European Union showed that they want to go global. So if you want to go global, you have to show that you are at least union in your vicinity. That if you want to go global from EU 28, then show that you are able to be European 44. And then you can say, okay, I'll go to the globe, 190 whatever countries. I think that integrating this enlarging countries like Western Balkan, for example, and neighboring countries, in which these 44 countries, among the one is Azerbaijan, I think it has to go through health, through green, and through digital transformation, are not only catalysts for overall EU enlargement, but also precondition that European Union wants to go global. In that sense, I think 3 points. First point, I think European Union can be driving force for European Union enlargement that go beyond Western Balkan and go beyond European political community, which I strongly support as an idea. But let's see how it will work. Will it have concrete results? Will our friends in Turkey see that they are part of that European community? Will our friends in Montenegro, in Bosnia, in Azerbaijan, will they see that they are part of that political community if European Union has to show that, for example, health is perfect example. Go health on 44. And try to show your leadership on that. Then you can go to Africa, to South America, and then you can try to be global Europe in any aspect of the meaning. So I think why we wouldn't have European health community like we had European economic community from 1957 to 1993 as predecessor of today's European Union. So I think the same principle should be, Rosen, applied to European Green Deal by integrating Green Deal, European Green Deal, go beyond. We heard 2 days ago with President Aliyev when we were talking about how Azerbaijan has ambitious and realistic goals to go in renewable. We were talking with Kjell Bondevik, we were talking this morning about, I mean, how a country like this, that is known globally and in Europe as an energy-rich country by resources, gas, and so on, is showing the leadership in renewable energy. I mean, of course, if you are Switzerland or Hungary, you have to go renewable. But if you're a country like this, I mean, to show leadership in becoming a renewable country, that's something that we should commend. So in that sense, I think I go to the second point. Is our correlation of strengthening concrete health and digital transformation as it was stated in the Leyen Declaration. And Philip reminded me of that, and I'll repeat, Philip, let me, Rosen, have 2 minutes on it. My country, Bosnia and Herzegovina, is 4th on global ranking by number of COVID deaths per million people, 4th. After Peru, after, Rosen, I know number 2 is you. Bulgaria is number 2. Bulgaria is number 2 on deaths per million inhabitants. And of course, I don't know where is Prime Minister Medjugorje. Hungary is 3rd. So I have 2 European Union countries before us on that death toll. Of course, what is interesting, if you take top 10 countries, that Philip, what I was talking about, referring was, on list, you will see that besides Peru and Georgia, Georgia is number 8. Remaining 8 countries are coming from that same cluster of Central Europe and Balkan, including countries that became members of EU in 3 different periods, as well as non-EU members from Western Balkan. Besides Bulgaria, Hungary, Bosnia and Herzegovina, next ranked countries are North Macedonia, where is President Ivanov, Montenegro, Philip, of course you are my leaders with us, Croatia, I see Jadranka over there in Ivo, Croatia, you are also leader in that tool, Czech Republic and Slovakia. So countries that is missing in this cluster, creating a white spot in that 8 out of 10 countries, it's interesting. I'm not promoter of that country, definitely. We'll talk about it later. I mean, Serbia. It's ranked 55, which is 2 to 3 times smaller that tool than other countries from broader region. Azerbaijan is 103. Azerbaijan is first country on the top list that goes below 1,000 death tool, which is about close to global average. So, Rosen, your country, my country, we are 5 times worse than Azerbaijan. Or your Philip, 4 times than Azerbaijan when it comes to that. So what I'm trying to say that, of course, there are a lot of potential reasons that are explaining this anomaly. But one of the most evident is state of the art of digital health transformation. Digital health transformation. Of course, that is based on business and government partnership, Tamer was talking about, that's enabled organized vaccination, integrating pandemic activities in overall healthcare system and went beyond with mobile-based patient care center, digital transformation, and so on. So this leads me to 3 sentences, 3 conclusions. First, European Health Union, if Europe wants to go global, it should start with integrating not only Western Balkan, but European political community. In European Health Community or European Health Union Plus. Number two, use best practices of patient-centered digital transformation as an integrative tool for national, regional, and global health for all that we were all talking about. And number three, someone has to pay for it. So include international financial institutions. European Investment Bank, for example. What is the job of European Investment Bank? Invest in a future, invest in production. And best production is save people's life and their people's health. So I think that supporting digital transformation of the European Health Union all the way to global health should be on priority of European. I'm not talking about World Bank and other, but European. If Europe wants to be Europe of values, Europe has to show. And is it better value than saving human life? So that's my third proposal, and I think that the prime interest of the European Union or European political community of values and prosperity, its prime goal. And health is a perfect way to show it. Rosen, you are, by the way, Rosen is our ambassador of Western Balkan in European Union, you know, together with President Stoyanov, because they are Bulgaria, and we were last night talking about B.B. King, right, the famous B.B. King, yeah. But he was talking about Bosnia and Bulgaria as a kingdom. I mean, the only way that we get shortcut in the European Union is to join one country like Bulgaria. We have Bogomil traditions or something like it. I mean, we can go. So, I mean, before we get into European Union without going to becoming BB King, we should try to be BB Health. I mean, anything with BB is just Bulgaria and Bosnia, no other BBs, okay? So I'll stop it here.
Thank you, Zlatko. And by the way, listening to Zlatko, you get one very simple but very important message, even a word. And he repeated and repeated again, integrity and integration. So we need to integrate. And the engine of integration, not just the European Union, plus the others, plus all the others, but only together. I'm moving by next speaker. By the way, if there is one address in the world, not just in the region or in the world, where everybody was watching during the pandemics, you would say United States or China or the European Union. No. United States was watching very carefully what's happening in that very special country for the planet, and that is Israel. And we're very proud to have today somebody who represents the very heart of the ecosystem of that country that continues wondering and surprising all of us with the results they achieve in any specter of society and economy. Is just a country that is on the up and going and modernizing. And today we have with us Professor Joram Weiss, who represents the Hadassah Medical Center as Director General of that very special center for health, which is targeting the best possible technologies and ambitions you can have. And hopefully you can share with us also, Professor, the results and the wisdom you collected during the pandemics and beyond. The floor is yours. Thank you.
Thank you, Rosen, and thank you everybody for being here. As you mentioned, Israel was one of the leading countries when it came to fighting COVID, and both in deciding to take the decision to go into lockdowns, which was a very, very difficult decision for a country, understanding the implications for the population and the economy, and then also leading the vaccine effort. However, I would like to focus on our organizations, which is the Hadassah Medical Center in Jerusalem. And we are a tertiary quaternary care center that is dealing with top-notch medical activities like CAR-T, which is the most advanced care for cancer. We just sold a company for multiple myeloma in this field. We're leading when it comes to stem cell therapy for multiple sclerosis and for macular degeneration. There also, we sold a company just this year. But at the same time, and this is the important thing, Hadassah Medical Centers with both hospitals is also a community hospital. And I think that when we need to address our response to COVID, we need to look also what was our work when it comes to the community. And we are serving one of the most diverse communities in the world, both multicultural, multinational, and how do we put all these people together and we work together in tandem to address the pandemic. So first of all, I would say is the issue of, in the organization, full transparency. And when I'm saying full transparency is, and I'm talking now before the vaccination, where there were major question marks, where there's a lot of stress among healthcare workers, what will happen to us when we go and treat patients. And the issue was full transparency about our support of them, full transparency of the fact what is the situation with personal protective gear in order to make them comfortable to address the pandemic. And then also trying to prevent the burnout that people underwent treating these patients. We took care during the pandemic of more than sometimes 250 COVID patients, all of them with very high acuity, out of them sometimes 70 patients in ICU conditions. However, the important thing is to prevent the burnout and to provide the psychological support to these teams in talking to them continuously. But then also we have to address what is the communication and what is the importance of the communication to the community. And when I'm saying to the community, it goes in two facets. One, when everything started, to explain to the community what are the public health measures that need to be taken and why they should adopt them. And the other thing then, and this was very soon we realized up to then, less than 2 to 3 weeks at the start of the pandemic, that we cannot neglect the other medical conditions that patients have. Now please realize, I know that today people think that the next pandemic will be fought within 130 days and we'll have a vaccine. Sorry, I'm also a researcher. This may not happen. So we need to be prepared for another pandemic where we'll have to deal, as we did, in two facets. One, fighting the pandemic, the other one, continuing providing the population all the other medical services. And this is critical to understand in order to fight the next pandemic. So, having said all that, the last thing is to address the mental health issues that the population is going, because we're talking all the time about vaccines, about medications, but we tend to forget that one of the major issues we had to deal with is the mental health and psychological stress that both patients, families, and young adults still now are suffering because of the pandemic. These are the lessons that need to be learned for the future. I would like to say also that I think one of the reasons that we were able to deal with such a high acuity of patients is because of the construction and the way our healthcare system is built. And this is also related to a very, very strong community healthcare service. This allowed us basically to allow those that are with mild symptoms and those with moderate symptoms to be treated in the community, and for a tertiary care center, a hospital, to focus on those with the highest acuity. And I think this is one of the major lessons that we need to learn for the next pandemic. We need to organize ourselves in such a way that the community physicians and the community can support the patients that don't need hospital services, so that the hospitals can focus on those that really need the major attention. And by this, we will really decrease the mortality and morbidity of our patients. Thank you very much.
Thank you, Professor. Very, very strong words and very wise words. Here is my last speaker, and then I will be turning the mic to all of you. My last speaker is a very special, I would say, world leader. He served as Prime Minister of the UK for the period 2007-2010. He serves as a Special Envoy of the UN on Global Education. He serves also as WHO Ambassador for Global Health Financing, and he is a wonderful human being we all love. That's the Prime Minister of the UK, Gordon Brown. So we have a video message from Gordon Brown. Let's listen to his wisdom.
Let me first pay tribute to the work of NGIC. It's a constant positive presence in our lives and in the lives of countries. And I want to thank you for the advice, support, help, and wisdom you've applied to the many crises we have faced. And let me pay tribute to all the board, your executive head, Roshan, and all of you traveling from country to country, spreading the message of peace and reconciliation, something ever more vital as we salute the spirit of the Ukrainian people, more than 1 year into their fight against Putin's crime of aggression. Lives have been destroyed, but the spirit of Ukraine remains indestructible. Hearts have been broken, but the resolve of the Ukrainian people is unbreakable. And I want today to salute the courage of the people of Ukraine. I want to talk about one of the crises we face, the continuing global health emergency. It was said of the 18th century Habsburg monarchs that they would never learn from their mistakes. And just 3 years after the whole world was unprepared for COVID, we are seeing signs in 2023 that entire countries have seemingly failed to learn from the previous mistakes. And they've relapsed into a new complacency, which is depriving global health of the finance it urgently needs to combat existing diseases and prepare for any future infections. Even now, despite the availability of vaccines globally, only 1 in every 4 people in low-income countries have been vaccinated against COVID. Simultaneously, other health crises have mushroomed, not least through COVID-induced delays in the treatment of other conditions. 25 million children worldwide are at risk after regular vaccinations were deferred. Because of the additional pressures on food, fertilizer, and energy supplies as a result of the Russian invasion, 109 million of our fellow citizens are on the borders of starvation. And perhaps even more worrying, the World Health Organization calculates an unprecedented total of 329 million people are in need of urgent assistance, whether it's across Afghanistan, Ukraine, South Sudan, Ethiopia, Yemen, DRC, and the Horn of Africa, where as a result of war, plagues, famine, droughts, and floods, specialized medical supplies and expertise are needed immediately if we are not to abandon the sick to disaster, disease, and death. In other words, the health emergency is not over. There are today 55 chronic and severe health crises, 11 of them extreme, and the World Health Organization alone needs an urgent infusion of funds if men, women, and children are not to die unnecessarily this year from avoidable illnesses and disease. Now, the great physicist Albert Einstein defined insanity as trying to do the same thing again and again and again, expecting different results. Having failed to invest before, and today failing to invest now, we will pile up huge problems for later if we don't invest into the future. The funding crisis starts with the failure to secure an all-round increase in the domestic mobilization of health resources. The research team at the Washington-based Center for Global Development has examined spending projections for the coming 5 years. And according to them, in only 67 countries, government spending is projected to increase steadily through to 2027. But in 110 countries, we are simply not doing enough. 41 of them, government spending until 2027 is projected to remain lower than before COVID-19, restricting the ability to invest in all the health needs that we have to meet. And perhaps these figures are not surprising because 15% of low-income countries are in debt distress, an additional 45% are at high risk of debt distress, under severe pressure with overall debt levels at record levels, and many governments struggling to meet interest payments on public debt. And with these rising interest payments, we constrain the capacity of low-income countries to spend more on health, education, and human capital. And too many countries are now spending more public money on debt interest payments than on health itself. In the absence of this domestic mobilization of resources, internationally coordinated funding is even more necessary if we're to save lives. Not just to help countries in need, but because COVID has taught us that no one anywhere is safe until everyone everywhere is safe. Too easily, the world has forgotten the expert advice that we are living to the sound of a perpetual drumbeat with the prospect of more frequent epidemiological dramas. Yet with major gaps in surveillance, testing, sequencing, when it comes to infectious diseases, we are now doing less than we need to do, just at the time we need to do more. Expected global financial losses from the pandemic have recently been estimated at over 800 billion annually. But securing a fraction of that in global funding for pandemic preparedness or just for more health treatments has become even more difficult. Act A, the brilliantly innovative approach to global coordination, working with the WHO, has been consistently underfunded, receiving in the last year only 16 of the around 32 billion it needed since the pandemic began. The Global Fund did a sterling job in financing its replenishment, but it will be the first to say that although it secured 15.7 billion, it needed to meet its 18 billion target. The board of the vaccination facility Gavi has declared 2023 a year of renewal as it tries to deal with the backlog in COVID and other vaccinations. But the new World Bank-hosted pandemic fund, created in response to findings by the G20 Pandemic Preparedness Panel and the Pan-European Commission on Health and Sustainable Development, has received 1.6 billion in pledges, but not yet, and is far away from its 10 billion a year funding target. Along with climate change, pandemic preparedness was one of the underfunded global public goods that justified the creation of the IMF's Resilience and Sustainability Trust Fund, with 143 countries eligible to receive support. What's good news is 20 billion of its target of 43 billion has been raised. Barbados, Costa Rica, Rwanda, followed by Bangladesh and other two countries at least are in line for low interest loans in 2023, but none of the funding is for pandemic preparedness. Indeed, rules for disbursement have been agreed on climate change, but are not yet far enough on the drawing board for health. The WHO has successfully secured far more guaranteed funding based on a country's capacity to pay, rising to 50% of this year's budget by 2028. But that does not relieve it of every year still having to pass the begging bowl round. Its 6.75 billion biennial budget, 1.25 billion of which is allocated to health emergency, still leaves it painfully underfunded for what we expected to do. For it's not just vaccines that continue to arrive slowly in the world's low-income countries. Take COVID antivirals like Paxlovid that, taken within 5 days of the onset of symptoms of contracting the disease, could reduce extensive hospitalization by 90% and avoid unnecessary deaths, and could be distributed on a non-profit basis. But we don't have the funds to do so. What's more, despite a daily target of one test for 1,000 people, low-income countries tested an average of 60 times less than high-income countries in the last 12 months, very far from the daily target we set as a global community of one test per 1,000 people. More longer-term provision is necessary. We need to continue to expand disease surveillance everywhere, strengthen our laboratory systems, improve emergency communication and coordination and management within health, strengthen critical health workforce capacities, recover some of the momentum we have lost in genomic sequencing and in other ways of dealing with samples. And we need, of course, side by side with the new pandemic fund, the World Bank should establish a facility to procure and support the production of medical goods and treatments in the event of pandemics. And IMF officials have proposed a credit line of 20 billion, an advance commitment facility fund for the pooled purchase from day one of any future pandemic of vaccines, tests, treatments, and PPE, which should happen immediately. Now there's another issue. With 23 million refugees, 80 million displaced people around the world, a population of displaced men, women, and children bigger than the size of Germany or the United Kingdom or France. And despite the WHO's absolute determination to carry out its duties as the health arm of emergency assistance, global health has received little more than 10% of humanitarian aid funding and just 5% of the amounts that are deemed essential when we put out any appeal. Now, financing is a key element of discussions by countries that are developing the World Health Organization Pandemic Accord, recognizing the importance of national investment for vaccines, PPE, and other measures needed to achieve the objective of this pivotal international agreement to protect and promote the health of each government's people. The Pandemic Accord represents a historic, necessary opportunity to both make the world safer and healthier and to align countries around a common approach. We say that we value every human life equally, but if we do not vaccinate everyone equally, offer life-saving treatments equally, and care for everyone equally, that failure to fund is a scar on our soul that will not fade. It's a wound that will not heal. It's a blight on humanity's common conscience that will not mend. And if we do not act, things will get worse. When we think of climate change, we think of hurricanes, floods, droughts, firestorms, and melting ice caps. But we must now consider a far less visible, but equally insidious killer force, the unprecedented surge in the number of waterborne cholera outbreaks, now in 31 countries, and linked as are vector-borne diseases to climate change. What we now spend this year on conditions from malaria to measles, from diabetes to dysentery, from Ebola to epilepsy will determine who will live and who will die. And so it could not be any clearer that our budgets are moral statements. The finance we give reflects the value we place on human lives. In the global health, in time, global health must enjoy sustained and sustainable finance, with burden sharing based on countries' capacity to pay, that avoids having to pass around the begging bowl from crisis to crisis. And today I want to plead with donors to respond urgently to the emergency appeal by the WHO to fund the vaccines, drugs, treatments, equipment, and medical expertise we need. For that to happen, all must acknowledge that controlling infectious diseases and delivering better lives, better global health is a global public good. We need a burden-sharing agreement between countries to finance it. We cannot continue to treat the financing of pandemic prevention as if it were a whip round at a charity fundraiser. Instead, the best way to ensure all benefit is for everyone to share the costs equitably based on each country's capacity to pay. It is a principle we established for UN peacekeeping, for IMF and World Bank financing, but it is the only sensible basis to guarantee we are prepared for the next global challenge. Hope dies, when pharmacy shelves that should be stocked with drugs and treatments are bare. Hope dies when doctors and nurses do not have the tools they need to provide even the most basic of care. Hope dies when vaccines that could save lives are hoarded in the rich north, only to be destroyed as they pass their use-by dates. But hope will come alive if we can fund the medicines, provide the doctors, equip the health workers, and avoid preventable deaths and suffering. Let us never forget, we cannot be at ease when millions remain ill at ease. We cannot be comfortable when so many go without comfort. We cannot be secure when so many people round our world are now insecure. But we are richer when we care for the poor. We're enlightened enough also to know that when we care for the weak, and the strong care for the weak, it makes us all stronger.
Very strong words from a world leader about hope. So now I'm turning to my audience. Very happy organizers, microphones are ready. Be strong, be short. And just one last thing, I promised you exactly in 18 minutes, coffee is coming. Be efficient. The floor is yours. Thank you.
Thank you, Makhar from Canada. I wanted to thank you, Minister, and Yoram, and our panel for the excellent presentation. The Executive Director of the World Health Organization mentioned the 5 pillars: promoting, providing, protecting, powering, and performing. One thing really saddened me that prevention was not one of those key components of the 5. The reason why I say that, because our medical system now seems to be dealing mainly with symptoms rather than going to the roots of the problem. And the Minister, as well as Yoram, both mentioned mental health. And according to the World Health Organization in 2022, 15% to 20% of the world population are faced with mental health issues. These are people who are diagnosed, but I believe it's bigger than that. I think to the tune of 30% of the world populations are dealing with mental health issues. And what are we doing about it? Really, frankly, we're not doing much about it because we still continue to be focusing on the notion of medicating our patient. A patient that arrived to a clinic, the very first thing a doctor will say, okay, what are your problems? And then prescribe medication and go ahead. But what is required, frankly, is to implement a mechanism where mental health becomes a fundamental part of the healthcare system reform. And to that extent, I think we are missing the point. We need to reform the system that no patient will have to leave a clinic without having an assessment, mental health assessment. We have to have access to patients so they can have a psychologist who can treat them. In North America, for example, and as well as other parts of the world, you have to wait up to 8 months to receive a mental health support. When I talk about mental health support, we're not talking about only depression. We're talking about anxiety. We're talking about fears. We're talking about eating disorders. There are many elements of mental health. If you wanted to go and have a job and apply to a company for a job, if they ask you a question about whether or not you have mental health issues, if you answer yes, you're not going to get the job. An insurance company, if you go and apply, you wanted to have an insurance. If you say you have a mental health issue, you will not get an insurance. So therefore, government must implement a mechanism where it becomes illegal for a corporation to deny you a position if you have a mental health issue. An insurance company have to also allow you to have insurance despite the fact you have a mental health issue. Mental health issue is a big issue, and we're missing it. And we need to look at a way in order to deal with it.
Thank you very much. Thank you very much. We're collecting more questions. Please use the microphone. Be active. Here's a question.
Thank you very much. This was fantastic to hear the great wisdom and suggestions from the panel, from President Vojanovic, Zlatko, Joran Weiss, and all the others. And I was very impressed by what Gordon Brown said. In fact, it was such a machine gun fire of facts and figures and values that I would like to suggest that Nizami Ganjavi put together a letter which we could all sign that would appeal to the governments concerned to really do what is necessary to invest substantial finances in public health and in prevention, as has just been mentioned. I would go beyond just addressing a letter to governments, though. I think a letter has to be addressed to the major corporations and the super wealthy, ultra high net worth individuals in this world. There are 10 men in the world who are the richest men in the world, whose collective wealth exceeds the GDP of Brazil or Mexico or Egypt and so on. And then there are companies that have experienced enormous windfall profits from the current crisis, from the energy crisis, and I think they should be asked to really pitch in to the future health of everybody.
Thank you very much. Thank you very much. We have 2 more questions to go. Who else would like to speak, ask? Because we will have just 1 round of questions, and then we will be closing up the session. Please, there is 1 more question. Please. Thank you.
Thank you.
The floor is yours.
And all the panelists. I just would like to raise a question with regard to the issues of equality in access to health in terms of the between developed country and equal access in developed country, but it at the same time between developed and developing country as well. Like in the case of the vaccine access, there are a lot of problems already. So what are the challenge and possible solution for the future preparation to the pandemic as we talk today? Thank you.
Thank you. Very important question. Thank you. Somebody else from the audience? This is your last chance. There is 1 more question, please. I think it's a young leader coming.
Hello, everyone. My name is Rudolf Skrumic. I'm from Latvia. As you mentioned, I'm a young leader. And as a young leader, I've been seeing this high increase in mental health questions for youth and mental health in general, and the decrease and increasing anxiety. What has been done and what are we doing now to support our youngsters in mental health questions? And are we doing enough, or if we should do more to help and to prevent these other diseases that are stress-related later on?
Thank you. Thank you. Very important question, also facing the future. Well, if there is no more questions from the audience, I'm turning to my panelists. Each of you will have a minute and a half. Shoot, go ahead. Madam Director General, the floor is yours.
Thank you. There were two questions I'd like to pick up on. One is about, are we doing enough on mental health, on well-being? No, we're not. All institutions, governments are underinvesting in this. And it is young people like you who must push us hard to do that. When COVID hit, we realized in my organization that particularly younger women in the organization, younger women with children, and young men living alone were suffering immensely from the lockdowns. And we invested some more, we put in more, we hired a team, we hired a well-being officer. We're not where we should be, but it is COVID that woke us up to the need. We all have to. On the question of inequity in access to medicines, this is wired in the whole global economic governance. We have to work on changing that. First, there is the rules on trade that allow monopolistic trade in life-saving health technologies. That has to change. We fought hard for that change. We were in alliance with the center here, CGIC. We fought hard for the rules to change so that there is protection of people during crisis, health emergencies. We didn't win at the WTO, but now we can still fight for it in the Pandemic Preparedness and Prevention Treaty. There are opportunities, but there are also other rules that work against public health, like tax rules that allow the same companies to take their profits out of where they produce and deny key public resources to governments to pay for health and education of peoples. Tax rules must change too. So there are systems, there are rules within the global economic governance that militate against equal access to medicines and the opportunity to give everyone health as a right.
Thank you, Madam. I'm turning to you, Madam, from the International Atomic Energy, listening to the young leaders, but also listening to the doctor from the first row about the mental health. I'm just enlarging the question and asking myself in front of you, can we commend the mental health of a world leader that is bombing nuclear power station in Ukraine? Could be a good question, please.
Thank you. That's a good question indeed. And we are not, the agency is helping countries that they decide and they choose to go for nuclear power on their own decision. Yeah. We accompany them to do that in safe and secure manner. So that's one thing.
Yeah.
Now, is about mental health and the relationship to the impact on nuclear power. Look, when you take the plane, how about that? Are you secure? Are you safe? You know, you have more accidents by train or by car than nuclear powers. How many nuclear power accidents we had in the past? I'm not defending, but I'm saying we need to inform. This is, I talked about nuclear power. But let's move to health again.
Perfect.
Health, I think those youth that they are insecure and they are anxious because we are not informing them well. Because there is a lot of misinformation out there in social media, and this is what we need to fix. And again, we need to empower, like my colleague said, communities to take those women and those youth in charge to also inform them adequately about anything, be it health, be it nuclear power, be it pandemic, be it food security, climate change, all those global issues that we are living in. It's about information. It's about taking care of our women, our children, our youth. And it's the role of each one of us.
Yeah,
Thank you.
Thank you very much. Mr. President, closing remarks of a head of state, please.
Was trying to explain two regimes of Montenegro concerning coronavirus. International community has small and big countries, poor and rich countries. It's a better solution to have a big and rich country. And it is a good solution to have small and rich country, as, for example, New Zealand is. Montenegro is small but not rich country. And it was impossible to have a regime with isolation of our citizens in our home and border, a close border country. It is impossible. Montenegro is not island country, and Montenegro is relatively not so rich country, to say. And I think that support of the European Union, of regional health organization, World Health Organization, and common activities of all is solution for solving all countries. I think it's necessary.
Thank you. Thank you very much. Thank you. Mr. Minister, the floor is yours.
Thank you. Regarding mental health issue, I would especially point out that there are no ways to manage this with old-fashioned methodology. Because new generation, when we talk about young adults, even children, that are affected by incredible flow of information, by using digital devices, not always properly managed by their adults even, we should elaborate absolutely new approach. We should re-estimate the profile of forthcoming civilization. Without that, mental issue will grow, and each society, I don't want to say globally because it's quite dangerous and sensitive issue, but each society will face their own issues by growing number of mentally deteriorated population. Regarding inequity in vaccine distribution and drug accessibility, you know that Azerbaijan holds chairmanship in non-aligned movement and first raised the voice against vaccine nationalism when just before the vaccination started actually, some countries hold 5 times more vaccines than they need at the time when other countries were suffering to get at least a couple of doses. For sure, international unified platform for fair distribution, not only vaccines, okay, vaccination is a backbone of public health globally, we agree with that. But what about essential drug list elaborated by WHO? Which countries really follow the rules and share with extras they have in their stocks, close to, let's say, expiration dates even. And this is not the point of humanitarian willingness to help to the neighbors. It's shared responsibilities for global health. And today we discuss these issues. For young leaders, regarding the mental health, I mentioned in my speech, healthy lifestyle. You should have healthy body, healthy mind, healthy soul. Without that, Without this integrity, no health at all. Thank you.
Thank you very much. Thank you. Zlatko.
Rosen, you're my friend. I thought you were going to introduce me, as now we'll hear some boring remarks, and then I surprise people by saying something interesting. So
you fix the European Union and Euro 44. Now you fix the world. Please.
So now the floor is mine. I mean, simply, I think it is very important that, I mean, a lot of us were raised in so-called Eastern Bloc or Eastern Europe, and some of us in Yugoslavia were something in between. But we used, and that was not only our approach, that healthcare and education was set as something as a spending, not production.
Yeah.
In our budgets, in our mindset, the healthcare and education was spending. So someone has to produce and to earn, and then we who are in education or healthcare, we are spenders. I think that is significantly transformed now. We have to transform the mindset that healthcare and education is infrastructure of production. It's precondition for production, it's part of production, part of productivity, part of creating wealth. And I think it is very important to understand that, and I think that when you look at, for example, there's a latest survey of McKinsey Institute talking about what is the job growth projections as percentage of changes from 2017 to 2030. So health professionals and health aides and wellness, including wellness, growth in those two sectors are number 1 and number 3 among overall, regardless of artificial intelligence and overall artificial intelligence technology growth is grouped in so-called STEM, as science, technology, engineering, and management professionals. They are ranked number 2 altogether. So health professionals' growth of jobs is bigger than overall STEM in the next 6-7 years in front of us. So I think it is very important to understand that this is the countries that are part of this are going to be the leading economies of the world. And I think that's one of the messages that we have to understand, that, I mean, these workers are, number of the growth of the workers in healthcare is 2 times bigger than overall STEM in next 7-8 years. And that is something that should be core message for us, changing our mindset to the healthcare.
Perfect. Brilliant as always. Thank you. Professor.
So very quickly, I would like to address not the inequality in vaccine, but inequality of knowledge, because when there's a new outbreak, we as physicians are very well acquainted with using good medical practices. When there's a disease, we know what to do. When there's a new disease that we do not know, there's a lot of uncertainty. And one of the things we've done is we very quickly arranged a group of knowledgeable people that wrote protocols of good medical practice, how to address COVID, but every 2 weeks we updated that, and this was translated into English and to Spanish. And I was amazed to see, traveling the world immediately after the vaccination, how many institutions in South America and in East Asia use these protocols. I think this is something the WHO should write down as a note for the next pandemic, to have protocols on how to address and to update it very often. Secondly, when it comes to healthcare, I think also that we need to use open sources. So when there's an outbreak and we have a good idea, we need to share it. We shared our ideas when we thought there will be a lack of ventilators. We put it on the internet, how to construct ventilators. I know about one country, one hospital that used it in order to create ventilators for them. And finally, when it comes to mental health, unfortunately, I think all of us are underfunding and understanding mental health. Thank you.
Thank you, Mr. Minister. Thank you, Professor. Dear friends, let's have a big round of applause for our audience, and let's enjoy coffee break. Thank you.
Excellent. Thank you so much.
Thank you. You were great. You were great.
Wonderful. Thank you.
Thank you.